The National Library of Medicine is the biggest medical library in the world. Congress was for some years anxious that patients, their constituents, know about what experiments were going on with, particularly in the areas of dangerous and life-threatening diseases. So what kind of trials were there, and could they get into them?
ClinicalTrials.gov is intended to be a comprehensive resource of clinical trials for serious or life-threatening conditions. And the site is unique not only because it is as comprehensive as it is, and we continue to add more information to it, but I think also because every design decision was based on the fact that we were trying to serve the public. First and foremost, patients, families, and other members of the public.
Breast conservation is definitely the result of a clinical trial, and thousands of women have their breasts today because of that. And survival. You know, clinical trials were what told us that hormones work well in breast cancer.
ClinicalTrials.gov was extremely valuable. You know, I wouldn't have known where to go, who to contact, what the numbers were, without finding all that information in one site.
The other important part about the database is that it lists all private and public clinical trials, which is a huge issue these days because 80% of all clinical trials are done by private clinical trial organizations.
You've got to be awfully grateful to the people who have participated in the trials that say tamoxifen is now preventative of cancer recurrence. Well, somebody had to discover that, and that required women being willing to participate.
I've had AIDS for 23 years. I would not be alive if I didn't have access to clinical trials, because in the early days there weren't any drugs. The only drugs that were available were experimental ones in clinical trials.
Patients are often, particularly those who are suffering from serious or life-threatening conditions, are desperate for knowledge and information. And if I've been able to play a small part in that, then I feel very good about having done that.